Violette. Hi, and welcome to our short podcast on the power of hope. This is where we try to bring much more information and vision around Istanbul Convention, and also on what's happening around on the good things which have evolved around the protection and services. And also we heard a lot yesterday during the conference on your model in France, and so we are very excited to learn a little bit more about it. Can you share with us and our audience about what you are doing and how is the center organized and everything else?
Mm-hmm. So I work for La Maison des Femmes, which is an initiative that was started by an OBGYN, a doctor, in 2016, and she wanted to treat violence against women as a medical problem, a health problem, and because she worked in a hospital, she decided that she was going to open a unit for women victims of violence in the hospital. And that's how the first Maison des Femmes was opened, and it is a center that's a health center first and foremost, but it has all the professionals a woman might need to get out of the violence in the hospital. So she can see a psychiatrist, psychologist, a social worker, a lawyer, a police officer, a sex therapist, any other type of physicians, a midwife in the hospital. She can press charges in the hospital, and instead of having to seek these services, they come to her within the frame of a hospital unit. And after the first one was created, a lot of other doctors asked to do the same thing in their hospital. So we created a label, the Restart label, and we label new units that open in hospitals that care for women victims of violence, and there are 31 in France to this day.
Wow, it's amazing. Actually, the organization I'm with, the Community Safety Mediation Center, we are also having one of our services inside the Forensic Medical Institute in Iași. And I must admit that it's a first step on the one-stop shop, because victims are coming for injuries, and so they are both can be seen by, and also the police can come, and also, so I think, but it's very, very early in Romania, this model. So that means only women who are seeking support because they have been injured physically and arrived to the hospital are entering into this? No.
We also have a family planning unit within our Maison des Femmes, and so a lot of women first come seeking contraception, an abortion, or gynecological care, and because we do systematic screening, so we systematically ask for a history of violence, then usually that's when they'll reveal violence, and then they can be taken in through the violence unit. We also have a unit dedicated to women who've suffered female genital mutilation, and we have a lot of women who go to the OBGYN for a regular checkup who have never been told that they've been cut as children, and then when that fact is revealed to them, they come to us and we can address the problem as well. So it comes from many different ways. Our vision and our belief is that, you know, not all women will go to an organization for women victims of violence, because you have to first see yourself as a victim, you have to seek care, but all women will be faced with a health professional in their life. And so being based in a hospital and being a healthcare unit makes it that we see women that wouldn't necessarily go elsewhere but feel fine going to a doctor because it's a bit less stigmatizing.
Yes, that's true. And also it's not that they are immediately labeled as being abused or something, and so it's just could be just a healthcare problem, or that's a very good strategy, because as have we seen in time, in order to have the courage to make this first step, and sometimes, as you have said already, they don't see themselves as being victims, and they are not aware of all the signs, and so being in touch with so many professionals taking care of her, it could help a lot. Okay, so I think, well, you mentioned yesterday regarding funding. Do you think, in terms of, because this is something which we are looking forward to as many models as possible of sustainable funding. Right now, the core budget would come from the Ministry of Health, or how do you organize yourself in terms of
we
supporting?
are lucky enough that in France, healthcare is covered by Social Security, and because most of the workers who work in the maison are health professionals, they are usually reimbursed. The consultation is reimbursed by Social Security, and then we have some public funds as well from the Ministry of Health, but a lot of our funding comes from private funders, private foundations. So it's a public-private partnership that we wish was more public, but we don't have a choice just because it was kind of a revolutionary model back in the days, and it was an innovation to kind of put all these professionals in one room, and the private sector saw it more clearly than the public sector. They're easier to leverage for new initiatives than the government. So
yeah, so one challenge we saw in time is that usually the hospitals or emergency wards and forensic doctors don't have enough space into the buildings, because they are usually built to function or to serve the purpose of being like only medical. How did you succeed to have all this new development around your...
The first maison is a really nice one because the hospital gave us a parking land that wasn't being used.
I saw yesterday, I went to them to know that as
Yeah.
well. Yeah. I like that a lot.
Yeah. And we raised enough fund to be able to build a small house, and about a year in, we realized it was way too small, so we had to build an extension. So now it's fairly big, it's about 500 square meters.
Wow.
In other maisons des femmes that are less advanced than the first one, it can be housed within a hospital unit. So it can be in the maternity, in the forensic legal medicine unit, in the ER, and it only requires a few offices. It doesn't have to be this, obviously it's great if it's like a big house,
yes,
but it doesn't have to be that as long as you have the professionals
so you have
that are
the
working
core
together.
Team who are trained in...
Yeah,
okay.
and what happens that we see now is usually hospitals are okay with opening a violence against women unit, so they put it within the maternity or within an existing unit, and then after a few years, because it's grown so much and there's so many patients, then they find a way to have it within hospital but in separate grounds so that they have enough room.
Now, the last question, and it could be a little bit trickier, but there are some countries who have signed but didn't ratify yet the convention and in Europe, and we were wondering what kind of advice, so looking to your work and looking how nicely have spread and developed, what would you recommend to these countries in terms of maybe making the further steps to finish what they have started?
Yeah, I always think, I'm very cynical, so I always think that if countries and people can avoid working on violence against women, they'll avoid working on it just because they'll always say it's too expensive. It's only a certain type of people. They'll always find excuses not to care for it. So I think you should always talk to them in a language that they understand. Health is a great way to approach it. Getting doctors on board in medicine, because people respect medicine.
Yes, that's
There's
true.
something about the legitimacy of it that then is harder to, it's sad, but it's true.
You're against
So-
a healthy person.
Yeah, so if doctors say
Yeah.
it's a health problem, we see a lot of cardiovascular diseases, we see a lot of cancers, we see a lot of
The
these
ones,
chronic
yes,
problems
yes.
from victims of violence, then it makes it a medical problem and people are more likely to listen. And then the other thing is, violence against women is a very expensive problem. It costs a lot of money to Social Security in terms of productivity at work. As a society, it costs us a lot of money. So I think to governments, we should speak their language and saying if we don't
Yeah,
treat it,
health and
it's
budgets.
going to cost us money. So
So-
save money, save women.
Yeah, that's perfect. Yeah, so yeah, we'll didn't look on to the health approach yet, but thank you for that.
There you
And
go.
that would be very useful.
Great.
And now it will be much more easier for us to push forward. Thank you very
Thank you so
much,
much.
Violette, and it was a pleasure meeting
Yeah,
you and
thank
learning
you.
about your work.